Previous class we have discussed about the Supta Padangusthasana 1. That is, you have seen that reclining big toe pose 1. To just lift your leg up, hold the toe. Good pose for hamstring tightness, calf tightness. So today we are going to discuss about the Supta Padangusthasana 2. Reclining big toe pose 2. So here once again Shobit is with me to demonstrate the pose for you, my dear friends. So if you ask that how to do this pose, Shobit is going to show us. Can you please, Shobit, come to the laying down position, face that side. Yeah. So if we talk about the Supta Padangusthasana 2. In the previous pose, we have discussed about, just bring your right leg up. So it is a one range motion. The flexion of the hip is happening here with extended knee, right? Flexion of the hip with knee extension. Now, if you release the pose, can you please release the pose here? In control of the movement. Same thing, we have to check everything. If the arch is more, starting with, we can use the cushion or the roll mat under the lumbar spine, right? Because when I am taking this leg into flexion plus abduction with slightly external rotation. Flexion plus abduction with slightly external rotation. Tightness on the hips, right? Inner groin, adductor tightness. The pose is very nice for that kind of person who has too much tightness due to sitting jobs every day. So it gives you the intense hip opening with relaxation. So if you're talking about the thing with this pose, so modifications are there, right? Same thing which we have discussed on the last class. In the earlier class, we have discussed about the Supta Padangusthasana 1, reclining big toe pose 1. Now we are going to start with reclining big toe pose 2, Supta Padangusthasana 2. So how to do this pose? So many challenges come when we demonstrate this pose, when we practice this pose for beginners, my friends. So same thing, if we ask, bring your right leg up, brother. First you just check the range of motion, release. Suppose the right has 40, left has more. Bring your left leg up. So you can find this difference with the beginners that one range of motion is more, one range of motion is less. So we have to work on the person who has less range of motion on left side or right side. We have to go for that first. So balance first, right? So balance both limbs first. Release. Release. Now, if you are going to demonstrate this pose here, so bring your left leg again up. So this is happening flexion here, right, guys? The person has this much range of motion. So don't allow him or her, like when he is holding 45, and if I ask to do this, that other side pelvis goes rotate on the left side. This problem happens. If you see here, this rotation. So what is happening? People sometimes think that, oh, I get more opening. But you cannot see that how much compression you are putting here on your hip joint and how much overstretch is coming from the lower back. So it can damage your hip and lower back too. So what we have to do for this pose, my dear friends, like this much is the range. Then here you have to ask your student, just rotate your ankle out so you can create some space. Rather to do this with a neutral ankle, hip is tight here. So hold here, rotate your ankle slightly out, hold it here. You can bend your knee. When I'm coming from flexion to abduction, so there is a combination of the movement, bend your knee, so there is low lever, what we can say, short lever. If I am moving with the straight knee, long leverage is coming to the hip joint. If I am bending the knee, so weight bearing is distributed equally. So here we can see. If the person has less range of motion, what we can do? Just hold it here. Sometimes this happens with the beginners. I am not going to extend the knee and slowly I ask, can you please extend your knee? That's it. Hold it here. For other side, has not to be tilt. What we can do, we can use the one block here too. So I am using the block, if you see, this area, right? So pelvic has to be neutral, and I ask the client to hold this block and create some pressure here. So your pelvis doesn't move upside or rotate on the same side. So this we have to make sure that my pelvic is not tilting on the other side to prevent yourself from compression to the hip joint and overstretching of the ligaments from your lower back. Then the person can hold it here, right? The person can hold it here. Slowly and slowly, if we see, we can again put the strap on the center of the feet here, and we ask the client to hold it and try to press it. You can see how much range of motion. That leg active, brother. Neck, ankle neutral, the right side. Yes. Hold it here. So then slowly and slowly I can remove this. Pelvic neutral there. This way we can use too. So make sure the mistakes which we have to focus. No tilting of the pelvis. With the bent knee, you have to go for the abduction. With the beginners. Never go with the straight knee. That will create more damage to the joints too. So this is a simple way you can do, and there is no any imbalance. You can see on the both side, right is one line, left is in one line. So this way we can do with the beginners. Release, brother. Slowly and slowly, bend your knee first, bend your knee, yes. Then come to the inside, extend your knee and bring your ankle down. So this way we have to come out from the pose. I hope this must be clear to you. Second way, we are taking everything out from here now. The real pose. What is the real pose? Until you are not finding the balance, don't get stress. Don't create extra stress with your students on their joints, muscles and ligaments. So this is the hip opening and relaxation position also. But we say relaxative poses. So it has to be practice with relaxation, not with the force, not with the compression, not with the stress. Now, so take your left leg up, brother. See, pelvic is neutral on the both sides. Rotate the ankle out and abduct your left hip. So you can see pelvic movement is less. That's it. If you see the person has putting the knee up, no problem. We can give some block underneath it. Bend your knee slightly. That's it. So here the pelvic stable, knee stable. Supta Padangusthasana 2. Reclining big toe pose 2. As you feel that I'm getting more range of motion, then try to go for it. But make sure the pelvic has to be neutral. So reduce the range of motion slightly. Release the toe, no problem. Release the toe, reduce it. That's it. Until you don't find, if I'm removing the block from here, that's it. So if the main thing is the pelvic neutral, so no overpressure we have to give, just hold it here. Hold this one also. That's it. No problem. Slowly and slowly, we'll reach to the pose. So if you feel that my pelvic is tilting when I'm going to the final range, just use the strap, use the towel, and don't create any pressure on the both joints, right hip and the left hip too. So this way we have to do the pose, reclining big toe pose 2. Release. Bend your knee first, bring it inside. Very good. So this is the pose that we call reclining big toe pose. So no over forcing with your students, right? Slowly and slowly, use the strap, use the block on the both side, no pelvic tilting. Pelvic has to be neutral and enjoy the pose. Till then, thank you so much. Namaste. See you in next class.